Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. We're going to talk about depression and anxiety. I periodically review this because we manage a lot of depression and anxiety. One of the whole reasons I got so into hormone replacement therapy was the realization that hormonal derangement caused mood disturbance, which we now understand much better. But there's more to mood disturbance than just hormones. And so one of those things, which I always talk to patients about, and I've done many posts on, but I want to continue to emphasize it, is understanding the role of nutrition and vitamins. And the key idea is folic acid has to come into your body, go through your liver. Your liver has to add a methyl group, which is a carbon and two hydrogens. There's an enzyme called methylene tetrahydrofolate reductase that adds the methyl group, so folate leaves as methylfolate, wrappers off the chocolate bar. It can do something which in all of our cases is go to the small intestine and be the cofactor between tryptophan and serotonin. So if we're doing that successfully, our mood is generally going to be better all the time. Methylfolate is also the cofactor between phenylalanine and dopamine for mood also, but it's really serotonin where we focus. So when you don't methylate your folic acid, and the average Caucasian American is only about a 55% metabolizer, you don't make as much serotonin. And when you have more inflammation, more liver stuff going on, gastrointestinal stuff going on, you're not going to be making as much either methylfolate or as much serotonin, so it can affect mood. So one of the simple things we do here is use methylfolate. We use a product that's prescriptive when possible for people with more significant depression and anxiety called Deplin. That's just 15 milligrams, but it is the prescription version. But at Optimal Health, we're always evolving, and we use antidepressants too. The data on antidepressants is interesting because if you look at long-term use, they're not as successful as you would think, but my impression from using them on patients for 31 years of practice is they can be extraordinarily helpful. They work a lot better most of the time with Deplin, but sometimes Deplin does it all. But there are people that either can't take the medicine gives them side effects, or just doesn't work. So what do you do with people like that? And what do you do with people who the Deplin doesn't work? Well, one of the things we always want is behavioral modification. So things like watching your alcohol, watching your sugar, and then exercise, because if we get exercise, guess what happens? We get more mitochondria in our frontal cortex. You're going to hear me talk about mitochondria always, and that helps us with neurotransmitters and helps mood. But the big thing is there is technology that can help, and there is also something called counseling that can help. So counseling and learning skills to deal with depression and anxiety and how to box it and package it in your mind so you can keep it under control is a very important thing and has a role for all people with these challenges. But there's also some technology that is around now, which we'll be having here, which is one of the reasons I'm mentioning it. And it's called transcranial magnetic stimulation, or also known as ExoMind, because we're getting the 4th generation machine. It's an FDA approved treatment for depression. A lot of things we do in regenerative medicine, you can't say are an official treatment, but since this is FDA approved, it's actually an official treatment. The problem is, of course, it's not well covered or not covered by most insurances. But what it does is you just put a magnet on your head, and it puts energy or frequency into the brain for about 18 minutes, and you do it half a dozen to a dozen times, and it's going to resolve depression and anxiety about 90% of the time. It's phenomenally effective. It's a good choice for people who can't take medicine, or have had a hard time taking medicine, or they've had really bad depression and they've done ketamine and the ketamine hasn't helped. So it's just one more avenue of approach that's awesome. The price point has come way down. It used to be $18,000. It's now a fraction of that cost. Currently, at least at our practice, not everywhere, obviously. So a great thing. And then as on a final note, we are going to be hopefully having psychologists in-house again at the office every day. I've been working on that, and I think we have a solution with a great team of psychologists to come back in. We used to have a wonderful psychologist here, Jan Kimball, for 9 years, but she's now just on her own in the north side of Oklahoma City, doing great. But we would love to have a counselor readily available who takes insurance every day in the office, and I think we'll have that by May 1st. So very excited. So anyway, take care and God bless.